Hello again, all Apothékér podcasters. It's Jonathan Underhill, the man in Vienna, here for the EHP Congress. I've got another desert island drug for you guys. We've got Lisa from Canada, who's going to introduce herself and then tell us her story about the medicine that has had a big impact on her life. Lisa.
Hi everyone, thanks for the opportunity. So I'm Lisa McCarthy. I'm a clinician scientist with Trillium Health Partners in the Toronto area, and also a faculty member with the University of Toronto, Pharmacy and Family Medicine. And this story comes from so I did 10 years of practice as a GP pharmacist, or in family practice, and I was a newish practitioner as I was doing this, and one of the roles I had was to get involved in helping people to manage pain. So my desert island drug is oxycodone, which had a giant impact on my career. I was trained during the era where oxycodone was less addictive, non-addictive. Pseudo-addiction was a thing. Allegedly. There was no dose ceiling. Yes, allegedly. Yes. And so I have the book, the infamous book. I won't name the name of the company. And we were all trained that this is how we should go out and manage people's pain. So I remember a particular patient who stays with me. Was on a significant amount of medication and experienced now what I realized was opioid hyperalgesia. And that was a result of my recommendations to continue pushing the dose. I also recall being in workshops and talking to patients about pseudo-addiction and don't worry, you might be physically dependent. Yeah. So that medication sticks with me as an example of something where I caused harm. Yeah. And gives me pause and reflect, and also it's probably, I said to you, I would call myself a laggard in terms of maybe a late adopter on new medications. And for
cautious prescriber.
Cautious prescribing, yes, absolutely. And I've now, so that was part of my motivation for, I think really now my career is really focused on de-prescribing, making sure, honestly, people receive the medicines that they need, no less and no more.
Brilliant. Thanks, Lisa.
Thank you.
I don't like the word de-prescribing though.
Well, okay, we can talk. We talked about that. Medication
overload reduction.
Yes.
Indeed. So, what a fantastic story again. And the other thing, if you haven't seen the program Pharmacists, Dope Sick, which is on Netflix, I think, and it tells the story about oxycodone and how the pharmaceutical company basically exaggerated the facts, let's say, about oxycodone. It's a fantastic watch. It will give you goosebumps down your neck when you see it. It's a tough watch, but it really resonates with pharmacists who were around in the 1990s and 2000s.